Hi class, this is Dr. Heather Austin Roblard, and in this lecture video we are going to learn about night eating syndrome. So far this semester you have learned about eating disorders associated with controlling eating behaviors for weight-related issues. Well, night eating syndrome is associated with a loss of control and is strongly related to weight gain, overweight, and obesity. In this lecture video, you're going to learn about the prevalence, signs, symptoms, and proposed diagnostic criteria of night eating syndrome, or NES, theories about why someone develops night eating syndrome, and health consequences. In 1955, researchers observed obese patients that were characterized by their inability to manage or lose weight. And these patients displayed anorexic behaviors in the morning, meaning they weren't eating breakfast. Even hyperphagia, or consuming more than 25% of their daily food intake after their evening meal. And then they would experience insomnia. Originally, it was proposed that this occurred in obese patients who were unsuccessful in losing weight, which caused stress, and that attempts to manage stress were addressed through the pattern of eating, which was seen in our night eating syndrome patients. As the prevalence of obesity has continued to grow in the U.S., more attention has been given to NES, and we have a stronger understanding of its etiology today. The description of night eating syndrome is a circadian delayed pattern of food intake, which manifests behaviorally as excessive food consumption in the evening relative to total daily food intake. Recognized as a mood disorder, sleep disorder, and an eating disorder. It is not well researched in terms of the effective treatment option. For the prevalence rates of NES, it's thought that 1.5% in the general population may struggle with night eating syndrome. The prevalence is increased by those who have an increasing weight. So the more weight, the more prevalence or risk you have for night eating syndrome. Obesity clinics see a prevalence increase to 10% when they have an obese BMI. Bariatric surgery patients, prevalence increases up to 25%. Night eating syndrome occurs in non-obese individuals as well. However, it's the most prevalent among severely obese men. It's greater in men compared to women, and it's also greater in Black Americans compared to other ethnicities. There is also a high comorbidity rate with substance use disorders. 30.6% of those who struggle with NES also struggle with a substance use disorder. Here are some important terms to note when talking about night eating syndrome. Nocturnal ingestion is the eating at night or after awaking in the middle of sleep. Hyperphagia, which I mentioned earlier, is the excessive food consumption after an evening meal or dinner. This means that 25% of their food intake during the day happens after their evening meal. Our circadian rhythm is a 24-hour cycle in the physiological process of humans and animals that is impacted by temperature and sunlight. In night eating syndrome, this gets thrown off and impacts our appetite and our eating behaviors. Circadian rhythm and circadian intake of food. With NES, we see this as a disassociation with the circadian control of eating during specific times of day. In the latest edition of DSM-5, NES is categorized in the otherwise specified feeding or eating disorders criteria. The DSM categorizes NES as the following: recurrent episodes of night eating as manifested by eating after awakening from sleep or by excessive food consumption after the evening meal. There is an awareness and recall of the eating. The night eating is not better explained by external influences such as changes in the individual's sleep-wake cycle or local social norms. The night eating causes significant distress and/or impairments to their functioning. And the disordered pattern of eating is not better explained by binge eating disorder or another mental health disorder, including substance use, and it is not attributed to another medical disorder or an effective medication. What type of food is most often consumed during nocturnal eating periods for those suffering with NES? Currently, the research shows that food that is high in carbohydrates is the most often consumed for an individual who's struggling with night eating syndrome. As researchers and clinicians continue to have a stronger understanding of night eating syndrome and more empirical work in order to support it, we will soon be able to see the APA update the DSM to include NES as a full threshold eating disorder. The following slide outlines the proposed diagnostic criteria for NES. Under the first section of the proposed criteria, we see that it is consumed after the evening meal. It is important to note that the evening meal is intentionally vague, or in otherwise does not specifically use time of day to account for variations in timing of meals for different cultures or specific contexts. Think of a person who maybe works the night shift, right? Their evening meal might actually be their breakfast, so we're more thinking about the meal right before they go to bed. Although this is proposed criteria, this is currently not what's included in the DSM-5. So please remember that the NES is actually the part of the otherwise specified feeding and eating disorders category and is not a full threshold eating disorder. Certain signs for night eating syndrome. Individuals with night eating syndrome may be overweight or obese. However, they could be normal weight. They may have a feeling of out of control over their eating behavior. They could eat in secret or even eat when they're not hungry. They may develop shame and remorse concerning their eating behaviors. There may be a hiding of food out of their shame and embarrassment. They typically eat rapidly, eat more than most people would in a similar period of time, and feel a loss of control over their eating. They eat when they're not hungry or when they're uncomfortably full. They may be associated with guilt, depression, disgust, and distress. A majority of their food is eaten during the evening, and they eat little to nothing in the morning and wake up during the night and typically consume high-calorie snacks. It's important to note that with night eating syndrome, it is not about the amount of food that they consume, but the function of that eating. So they're using it in order to go back to sleep. Some of the traits of patients with night eating syndrome may include being overweight or obese and failed attempts of dieting. Similar to other eating disorders, individuals with NES are likely to have traits related to mood disorders, such as depression and anxiety. They may abuse certain substances or even have a substance use disorder. They have perfectionism tendencies, negative views about themselves, and concern about their weight and shape. Currently, there are a couple different screening tools for measuring night eating syndrome. The NEQ is used by professionals to assess and diagnose patients and clients with NES. The measure helps professionals to gather important information about food and sleep and recall dietary information, activity levels, and stressors. A score of 25 indicates that the further assessment is needed. If the patient scores higher than 30, the accuracy of the NEQ at diagnosing someone is 73%, which is a good validity. There's also the Night Eating Diagnostic Questionnaire, or NEDQ, which is 22 questions about their eating and sleeping, their level of awareness of night eating, and whether there is a distress over their eating behavior. And then the night eating syndrome history and inventory is an unpublished semi-structured interview. It's got 13 questions and it relates to the history of their NES symptoms or sleep patterns. As we've already mentioned, some of the medical impacts of night eating syndrome include that they are often obese or overweight. Thus, individuals are likely to struggle or be susceptible to health consequences that are related to being overweight, like high blood pressure, diabetes, or high cholesterol. In regards to diabetes, the prevalence rates of those with NES who have diabetes is anywhere between 3.8% and 12.4%, and having both diseases is associated with poor glycemic control and poor metabolic health. Those who are obese have an increase in their risk towards heart disease and many types of cancer or gallbladder issues. Individuals may often have a history of substance use and may suffer from depression, and they typically report being more depressed during the evening, which also can relate to frequently having sleeping disorders. In the medical field, when NES was first recognized, professionals had a poor understanding of the etiology of NES. They hypothesized that the behaviors stemmed from poor stress management. Today, the cause of NES is still largely unknown, but some promising hypotheses are being tested. Biological factors are strongly believed to be a cause of the development and maintenance of night eating syndrome. Researchers have proposed that NES is due to the disassociation of the circadian control of eating relative to their sleep. This theory has been given attention due to the findings that individuals with NES display that there is a 1 to 3 hour delay in melatonin, cortisol, insulin, and leptin, as well as glucose, which all impact one's desire to eat during the normal sleeping period. Melatonin shifts throw off an individual's sleep, while leptin, insulin, and glucose impact one's desire to eat during their sleep period. Melatonin is a hormone secreted by the pineal gland that is thought to be concerned with regulating sleep and wake cycles. Cortisol is a steroid hormone that is produced from cholesterol and is released when we wake up, during exercise, and in response to stressors. And in general, it plays a big role in nutrition. And yes, this is proposed to impact sleep and appetite problems. Insulin levels have been found to be higher in those with night eating syndrome, but is likely due to having NES than a factor that causes the development of NES. Leptin is a protein hormone that tells our brains we are full and helps us to maintain sleep. And for those with NES, they have higher levels of leptin, and researchers propose that the eating of high carbohydrate foods after awakening is used to help better promote sleep and to go back to bed after waking. It is important to remember these hormones as they are influential in our understanding of the psychological process related to night eating syndrome. For some researchers and clinicians, they view night eating syndrome as a subtype of obesity, while others view it as a variant of other eating disorders, particularly bulimia nervosa and binge eating disorder. Still, others see it as a separate syndrome among other eating disorders. Due to the dysregulation of sleep, others have also attempted to classify NES as a variant of a sleep disorder, termed sleep-related eating disorder, or SRED. What we do know about night eating syndrome is that it has predominantly been gained from research using overweight and obese BMI category participants. Largely, that research has ignored individuals who have NES but might have a healthy or normal BMI. The point here is that making a proper diagnosis of an individual presenting concerns can be difficult and a messy process. Eating disorders and most mental health issues reflect complex, interdependent, and multidimensional causalities that are triggered by a combination of genetic, biological, psychological, familial, social, and environmental factors. When you think of binge eating disorder, some patients will have compensatory behaviors. This is not a feature of NES and is thus a distinguishing characteristic that separates the two diagnoses. There will be some symptoms that overlap between binge eating disorder and night eating syndrome. And research estimates that 15 to 20% of individuals that have one disorder will both have BED and NES. So how do you know if an individual has night eating syndrome or binge eating disorder? Well, first off, the distinguishes are the amount of food eaten per episode will be different. With night eating syndrome, remember, it is not the quantity of food that matters, but when the food is consumed and with what pattern. The night eating is not a binge. You should also consider why an individual is eating. Do they believe that they will not be able to go back to sleep if they do not, or are they eating in response to a stressor? The belief that waking and eating will help them go back to sleep is more related to night eating syndrome. The individual with NES is likely to have a common cognitive distortion that those with binge eating disorder have, and other hallmark eating disorders. So an individual with NES is likely to be engaging in their eating behaviors due to concerns about their weight and shape. Finally, in NES, there will be reported sleep disturbances, and with binge eating disorder, this is not always the case, or this is not likely to be the case. SRED stands for sleep-related eating disorder and is one of the diagnostic terms that some researchers proposed NES should have been categorized as. SRED is a form of sleepwalking in which the individual has lack of awareness of their behaviors while sleepwalking. Thus, any food intake would not be recalled upon waking. During this sleep-waking eating behaviors, the individual may eat unusual or unedible food, and they may put themselves into dangerous situations attempting to locate that food. Finally, a hallmark of SRED is the amnesia. The individual typically does not recall what they did while they were sleepwalking. Hopefully it's clear from that description of SRED how NES is completely different and what makes them distinct diagnoses. With NES, the person is completely aware of their eating behaviors, and they do not eat inedible food upon waking, nor put themselves in dangerous situations to seek out food. SRED is a parasomnia and thus not categorized as an eating or feeding disorder. It is thought to occur in about 5% of the population and 9 to 17% of those with an eating disorder. We do know that about 65% of those with SRED are female and about 40% of those are overweight. Treatment for SRED is obviously different than night eating syndrome, and most research is needed to understand the relationship between these two disorders. That completes this lecture for night eating syndrome. We know that night eating syndrome is characterized by anorexic behaviors in the morning and binge eating patterns at night, as well as insomnia. In this lecture video, you also learned about the different proposed diagnostic criteria for night eating syndrome, about the differential diagnoses between binge eating disorder and sleep-related eating disorders. Because NES has only recently been recognized by the DSM in the otherwise specified eating and feeding disorder category, there's still not a complete understanding of this eating disorder, and it is still developing. I hope you enjoyed this lecture. Thank you.